You who are here for the second day, we appreciate your time. It is a wonderful announcement today. One of the great things about New Zealand is our sunny summers, but we all know that that comes at an enormous cost for many New Zealanders, and there'd be few among us who don't know somebody who's been lost to melanoma. There's around 7,000 diagnoses each year, and for people that have those diagnoses, it's a devastating cost to live in a beautiful sunny country. Nonetheless, the good people here at Melanoma New Zealand, I believe, have been doing a very good job of lobbying for better solutions over a long period of time. And I'm very pleased to announce today that Pharmac is proposing to fund 2 new treatments from the 1st of May. Initially there will be a public consultation, that's always necessary, but come the 1st of May these 2 new treatments will be available, and they're estimated to assist 160 New Zealanders per year who have melanoma. So it is a minority of all those diagnosed, but to those people it can make an enormous difference. It means that the chance of having to have further treatments and infusions post-operation is reduced by around 2/3. It's estimated that around 1,000 hours a year will be saved from the health system for infusion thanks to these new treatments. It's also an example of how Pharmac is operating differently these days. Once upon a time, Pharmac was warring with everybody and finding reasons to say no. Today, Pharmac asks itself how it can say yes to save more lives and get more treatments funded. And this is the 3rd example in 3 weeks after announcements around Trikafta and blood cancer medicines that Pharmac is showing how it can do more with less by being more efficient and making savings and economies elsewhere in its budget. So very proud of the way that Pharmac is performing. Very pleased to be able to make this announcement today that will make a real difference to what is sadly a very Kiwi disease. And also very grateful to be able to welcome Dr. Sonia Bodley from Melanoma New Zealand, who may have a few things to say. She's the expert and somebody who has devoted a huge amount of time and talent to this cause. So welcome, Sonia. It's great to have you here, and happy to take questions on this and other topics once Sonia's had her say.
Kia ora, everyone. Firstly, I'd like to acknowledge the Honourable David Seymour, Associate Minister for Health, and Todd Stevenson for the invitation to be here and speak with you today. My name is Dr. Sonia Bodley. I'm a skin cancer doctor and a Board of Trustees member with Melanoma New Zealand. New Zealand sadly has one of the highest rates of melanoma in the world, and even more sadly we have the highest death rate of melanoma in the world. And Melanoma New Zealand has long been advocating the provision of increased funding for melanoma treatments for melanoma patients, as well as providing expert advice and expertise to government agencies and other stakeholders. Today's progress towards more funding for melanoma medicines plays an important role in not only improving outcomes for patients, but also brings us much closer to international treatment guidelines. For advanced melanoma patients, access to these medicines provides more treatment options, reduces the financial strains on patients and their families, and allows them to focus on what's most important to them, which is their health and well-being. You can see today that we've got one of our 2 Melanoma New Zealand spot check vans, which we've had since 2021, and the ministers are welcome to have a free spot check and experience what that is like. And since 2021, Melanoma New Zealand has provided over 30,000 free spot checks to Kiwis throughout the country, detecting approximately 4,000 skin cancers, 1,000 of which are predicted to have been melanoma. Now, these numbers show that there is a need for a targeted national screening program focused on the early detection of skin cancer and in particular melanoma. Now, there's no doubt that early detection saves lives, and we would urge all political parties to come together in a coalition to recognise the need for this program and to scope out possibilities for this. Finally, I'd like to acknowledge all the people in New Zealand who are suffering from melanoma and their families, and acknowledge those that are sadly no longer with us. Today's announcement is a big step in the right direction, and Melanoma New Zealand will continue its commitment to provide advocacy for all those patients and their families. Thank you.
Thank you very much, Dr. Bodley. Any of us are happy to take questions about this, and if people have questions about other political issues of the day, I'm happy to take them, but I'd just like to give Sonia and this issue a chance first. Yep. We're also happy to acknowledge total contentment with the government on the 23rd of February.
What criteria will people have to meet to access the medication?
It'll be a specific stage of specific types of melanoma. I'm sure Dr. Bodley can talk in a lot more detail about that than I can. But what Pharmac has done is it's taken a medicine that was previously funded and it's extended it to new indications. So that is specific stages of specific skin cancers. If you have those, then doctors will be able to prescribe them publicly funded through Pharmac. So, you might be able to say more about this.
Yeah, so in particular we're at this stage talking about people with 3B to stage 4 melanoma skin cancer, and these treatments allow provision of treatment before surgery, which is something relatively new, and we're hoping that that will increase the disease-free survival of those people receiving that treatment.
Will they be able to receive it, say, after the sort of intermission as well?
So, yeah, there are treatments that exist already for people who have already had surgery and received therapy, but this just broadens our options.
Minister, if there's no further questions on this,
happy to.
Happy to move on. Do you support Australia's move to remove Andrew from the line of succession?
Well, if that's what the British government wants to do, I think New Zealand should join Australia in supporting that move. But I've got to say, many challenges in New Zealand. It's not the first place I would go.
So you don't personally support it?
No, I don't not support it. I've just said I do support it. I would just say that we're focused on things like health and affordability and crime. That this is not our top of the list of priorities.
Albanese has written an official letter to Sir Keir Starmer to express support for removing Andrew Battenwindsor from the line of succession. What do you think is the right thing for New Zealand to do?
Well, I think New Zealand should support it. I just don't think it's not an issue I would make my top priority.
Today, Medimap, which is obviously a medication platform widely used across New Zealand, appears to have been hacked, remaining still offline. Do you know how many patients have been affected by this?
The exact number affected is still to be determined as I last heard, but clearly this will be very distressing for a lot of people who have parents and elderly people in retirement villages and care settings, and it reinforces why it's so important that the government strengthens its work around cyber security. This is happening all over the world, and New Zealand cannot afford to be the weakest link.
This is now the second medical records provider to be compromised. Does Health New Zealand need to do better vetting?
Well, I think the challenge is if you have permission to hold New Zealanders' medical records, what criteria are you meeting? I think New Zealand has been behind other countries for many years on this. Our government is now working very rapidly to keep up, and this has been discussed in the highest levels of government as recently as a few weeks ago. So we're very aware that this is a challenge. New Zealand has work to do, and it is being done.
A ministerial briefing from Pharmac highlighted the chronic shortage of ADHD medication. How concerned are you about this?
Look, at any given time, there are always about half a dozen medicines where there's a shortage around the world. Pharmac has to hustle to get supply of those medications, and they usually do pretty well. So it's a problem. It can be a real problem for people that are in need of this medication. However, it's also true that at any given time there'll be a shortage, and I'm always really proud of the way that Pharmac hustles to make sure New Zealanders get access through global markets where everyone's trying to buy the same thing. We went through this a few months or about a year ago with hormone replacement therapy. That created some real anguish for people who missed out on these vital medicines, and yet Pharmac eventually managed to get back on top of supply, and I'm sure that they will do that with this too. That's not to minimise the anguish that people will feel, but Pharmac is pretty good at getting on top of these shortages when they occur.
The People's Select Committee found no budget savings were made in cutting pay equity as it was all redirected. What did that money pay for?
Well, things like schools and hospitals and getting roads built, the things that New Zealanders need, while pay equity has been focused on gender differences rather than a very bureaucratic system which was very expensive and didn't actually focus on gender discrimination.
It found the retrospective cancellation of existing rights was a serious violation of that rule of law. How do you justify that?
Well, that's what some people who used to be representatives thought. The actual Parliament said that this is legitimate. The actual government said that this is going to make pay equity simpler, more focused on gender discrimination and more affordable for the taxpayer. The real challenge for the likes of Chris Hipkins is show me the money, because he says he's putting affordability at the heart of everything, but how would he afford the $12 billion to go back to the unworkable system we had before? The answer is he can't, and that's why we're not taking him seriously.
Why will your minister not front up for an interview in response to the committee's findings?
Well, I'm not sure that's her position. I understand she's in Hamilton speaking today, but once again, a group of people who have self-appointed themselves as an authority may expect everybody to jump to their tune. Sorry if I'm not.
Minister, just a question on, so some proponents of New Zealand becoming a republic and New Zealand severing the ties with the monarchy would say that the saga around the downfall of Andrew Batten-Windsor would be an opportunity for New Zealand to go down that path to become a republic. What would you say to that?
Well, the alternative to the alternative to the monarch is an elected head of state, and I could probably point to a few elected presidents around the world who people aren't so happy with either. The truth is, whatever system you have, people will have frustrations from time to time, but I would say New Zealand's system of government, while far from perfect, is something that ain't broken, needn't be fixed.
Do you support science kits being developed specifically for Māori medium education, and what differences could there be from other science kits?
Well, the thing about science is that it's universal, so you might choose to use examples of Māori myths and legends and connect those to scientific exploration. For example, I've seen people make the point that the Māori fishing calendar can be tested against the facts today, and it stands up pretty well. But what's interesting is it's not because Tongaroa said that there should be a Māori fishing calendar or you should fish at certain times, it's because you can actually do experiments to verify that today. I think that shows that science is something that is universal, so yes, you can put your language, your stories, your flavour against it, but ultimately science is testing a theory against observed reality, and it doesn't matter what your background is, what you see in that observation is the same.
Does ACT support having a Māori curriculum?
Well, we certainly have one, and it is an official language, so people have the choice to learn in either language. We've opened 5 Māori-led charter schools this year, and if people want that option, they should have it. What we oppose is when some people who don't want to learn a Māori curriculum or don't want to do 10 karakia before breakfast are forced to as part of someone else's social engineering. Alrighty, folks, we'll really appreciate... Oh, you're about to ask a question? Sorry.
I was just going to go back to the topic here today.
Yeah.
How many people with stage 3-4 melanoma will miss out under the funding rules?
Well, the way the funding works is that if you have this indication, then you are eligible to have it prescribed by your doctor and funded by Pharmac. So the answer would be nobody. Of course, it does depend on your doctor making the diagnosis and giving the prescription. That I would never interfere in. But if the doctor does that, then it's good to go from the 1st of May.
If the results aren't as strong as hoped, will you review or pull the funding?
Well, we're constantly reviewing what Pharmac funds and how effective it is. That's why we're able to make savings and fund new things like this, even when we don't put in extra taxpayer money. That's one of the things I'm really proud of Pharmac doing. They're making savings elsewhere to fund new things. But when you fund a cancer drug for melanoma, it's pretty unlikely that you would stop funding that. That seems like not something that we'd want Pharmac to be doing. When we were elected, we had a massive fiscal cliff. We put in nearly $2 billion of extra taxpayer money precisely so we wouldn't have to stop funding anything. That's generally how we've rolled. Alrighty folks, we appreciate all your time and hope you have a great day. Thanks for coming along. I don't know if we're going to get skin cancer checks or what. We are, okay, yeah, we definitely are, okay.
Come on in. Let's clear out, guys, and we'll set this up properly.